Hello and good evening. This is Dr. J at Ask the Gynecologist. I want to quickly make a quick discussion of the importance of treating yeast Facebook so that people can also benefit from Facebook. Okay, so yeast infection is very common in most women. Yeast infection is also called candida. It's also called thrush in some part of the Western world. And yeast infection sometimes is very common at different times of a woman's menstrual cycle and at different times in her life, especially when a woman is pregnant. And the reason is, or when you're taking antibiotics. And the reason is that whenever a woman is stressed out, she's got an infection, she's on antibiotics, she's pregnant, the immune system drops a little bit, and also the vaginal environment will change a little bit, becoming more acidic. Becoming more alkaline. Normally, the vagina is a bit acidic to prevent infection, but whenever a woman is stressed, she's on antibiotics and all that, the vaginal environment becomes a bit alkaline, and it encourages yeast to proliferate, to become more, and become of a concern to women. Okay, so if you're on antibiotics, you're pregnant, sometimes you're prone to yeast infection. It becomes stubborn, recurrent. Yeast infection can be treated easily. Whether if you're not pregnant, you can use diflucan or canesten. If you're pregnant, you use canesten. Canesten can come as a tablet or as a pessary. I prefer the pessary. Okay, that it goes into the vagina, it dissolves there. And I would suggest that if you're getting treated for yeast infection, don't have sex. And the reason is that yeast infection makes the skin, the internal skin, but we call it mucosa, but I'll call it skin here for easy understanding. It makes the mucosa of the vagina, the skin of the vagina inside, very, very raw and easily can be traumatized during sex. So during sex, you have yeast infection already, it can easily cause tiny microscopic tears in the vagina wall, in the vagina mucosa, we call it as doctors, and it can open door as a port for other secondary infection to go in, chlamydia, gonorrhea, even HIV. So the yeast bacteria, the yeast fungus can make the vaginal environment very, very friable. That's why you see a lot of people that are pregnant, they have yeast infection. They usually have spotting as well because it makes the cervix spot. So if you got yeast infection, get it treated. Don't share sex toys. You're on antibiotics for some infection, chest infection. Let the doctor know that, I'm prone to yeast infection when I'm on antibiotics. They'll give you canesten to treat the secondary yeast infection that you might have, because the antibiotics you're taking, the stress infection, will make the vaginal environment a bit more conducive for yeast infection to be more prone. Now, yeast infection is not an STD. Okay, it's not sexually transmitted. No. Okay, it's just there in the vagina, and whenever the vaginal environment changes, it becomes more. So you see a woman, she's pregnant, suddenly she has lots of yeast infection. You treat it today, it's back 2 weeks time. It's common like that. It's not a big deal. It doesn't disturb baby. It doesn't, but it will make the vaginal environment very, very easily traumatized, that if other infections can easily go in and cause other problems. And I don't want any woman to go through that. But if you got yeast infection, you're being treated, try and avoid sex if you can. If you got yeast infection, try and avoid intercourse and allow the yeast to resolve. It takes about 3 to 5 days. 5 days most times. Okay, and that's fine. If you have recurrent yeast infection, then I suggest get screened for all forms of sexually transmitted diseases, chlamydia, gonorrhea, HIV, everything. It's very rare, but just get screened just in case you have recurrent yeast infection like that. Okay, thank you. This is a short video. It's just to capture some few things, and I'll come back with other videos later on. Okay, thank you. Thank you. God bless you all. Take care. Bye bye.